If you've had a bilateral tubal ligation or a salpingectomy for the purposes of sterilization, and let me just explain, bilateral tubal ligation is just cutting and burning of your fallopian tubes, and salpingectomy is cutting the fallopian tubes completely out for the purposes of sterilization. Do you feel like you've been properly informed of all the risks and benefits of that procedure? Looking back, do you feel like you asked all the questions and you got the answers from your OBGYN? Maybe you talked to your friends, maybe you talked to a friend nurse or somebody who has had it done, and you feel like you did your research. Do you feel like you were properly informed? I do not feel like I was properly informed. I had a bilateral tubal ligation in 2012, so over 13 years ago, and I thought I asked all the right questions. I thought I did my research, my mainstream research, my independent research, and I spoke to my OBGYN. I was a labor and delivery nurse then, and I had seen dozens and dozens of these procedures done on my own unit. I never heard of any crazy side effect or issues. The only thing that I always heard is it's irreversible and permanent sterilization. I asked my OBGYN, what is the worst that could happen? What are the biggest risks of it? And he said, oh, nothing. Just the usual surgical risks of anesthesia, yeah, like surgery, infection, bleeding, nothing really to worry about. You're going to be just fine. Well, when I woke up in the recovery room, I was not fine. I immediately knew something was very wrong. I felt really sick, but I also, as a nurse, realized, well, I just woke up in the recovery room and I need to give it my full 6 weeks of post-surgical recovery to see. After the 6 weeks, I was only feeling worse. I had a ton of pelvic pain, a ton of pelvic pressure. I felt hormonal. I started having all sorts of hormonal symptoms I've never experienced before in my life. And I started questioning what the procedure did to me. I went back to my surgeon, my OBGYN, and he said, oh, this has nothing to do with the surgery. It's all in your head. Women just make these symptoms up, but it's because they're getting older. But I thought, well, I didn't get any older by just 6 weeks. Well, this nightmare went on for 3 years. For 3 years, I bounced around doctors and had a ton of diagnostic tests and imaging, never producing any answers. But deep down inside, I knew I already had all the answers. My intuition was screaming at me for 3 years by then. Tune in for the second part of the story.